But I want to talk about the fact that almost 1.5 million appointments have had to be rescheduled as a result of strike action across the NHS in England, according to new figures. Health service have been beset by strikes for more than a year, as we know. Some aspects, the consultants, for example, have sort of sorted it out, the junior doctors not. Walkouts, a number of different staff, doctors, nurses, paramedics, physiotherapists. The latest strike by junior doctors, which was just for 5 days last month, led to 91,000 appointments, operations and procedures being postponed. Now, Matthew, you have a very emotive and personal story in regard to the NHS, in regard to your mother and ambulance waiting times, but I know you support the doctors in this strike. Just tell us your thinking about that.
Well, I do, because I feel that the issue isn't the striking doctors, who are, after all, just after fair pay and pay restoration after real terms cuts.
35%
over 7. Well, then
that?
you get around the negotiating table, don't you? And you come down to a figure that both sides
they've already agreed to
on.
9% this financial year, so they've taken their 9%. They're going to get another 3 probably. I think that is very much in line with inflation, and they should be happy with that.
Shouldn't they stop striking, Matthew?
I wonder if it makes up for all the years of real terms cuts that they've had. I suspect it probably doesn't.
I really want to talk to the junior doctors who say, isn't it terrible that we only get £14 an hour? Lots of us in our first jobs didn't get the salaries we now get now. But
yes.
I mean, are those doctors who've been working for 2 years not going to take the 35% they want, because that is historically related? I mean, I just think that a lot of patients want this to be over.
I'm sure they do, and I of course have sympathy with the patients. I mean, when the NHS fails people, it can cost their lives. And my mum waited 11 hours for an ambulance after a fall at home, the most distressing 11 hours of my lifetime, imprinted on my mind. I'll never forget them, and the indignity that my mum went through. But I don't blame the ambulance drivers or the paramedics. When they got to my mum, they were very kind and very caring, and she died 2 days later after an infection turned to sepsis. But the issue is with an underfunded, under-resourced, understaffed NHS.
Is it really underfunded?
And that's the fault of this government.
Is it really I mean, Matthew, I think
it's had more money than it's ever had. Sorry, Peter.
You're absolutely right. I mean, when the Conservative government and the Liberal Democrats in coalition came in, NHS in England had £139 billion a year. Now it has £180 billion a year. I mean, there would be loads of parts of the civil service, the public sector, that would love a rise like that. Shouldn't they learn to live within their means? Isn't it about reform? Isn't it about changing the NHS and making it work more efficiently?
I think we need to face reality, and the reality is that a modern health service in a Western democracy for 60 million plus people is always going to need significant more amounts of funding going into it. I think we need to face that reality.
Samara?
I think funding is not the issue. It needs reform. We need to get rid of the consultants. We need to bring matrons back into the wards. I think that we need a complete overhaul.
Get rid of consultants?
Yes, the consultants are earning...
not hospital consultants, but people like PwC and Deloitte and things,
but also the consultants in the hospitals as well. I mean, they're earning massive pay packets. I think that also
are you saying you get rid of hospital consultants?
Well, there are consultants in the hospitals in the NHS that are earning 6-figure salaries.
But they're the senior doctors who are dealing with complex illnesses. Do you not think that's a fair salary for the job they do?
No, I think it's a fair salary. I just think that in terms of the whole system, it does need to be reformed from the top down. Okay, that's what I'm trying to say. But I think with junior doctors, they should be happy with the 9% pay rise that they got. And it's not a profession that you get into for the money. It shouldn't be. I mean, it should be about helping people, no? It just baffles me sometimes.
But we should value our doctors and our nurses, and I think quite often we don't value them.
The junior doctors are not having a cost of living crisis, they're having a cost of lifestyle crisis. I think that that's the main thing. I'm friends with a lot of junior doctors. I don't see them financially struggling. I think that our younger generation needs to be happy, as you said earlier, Peter, about earning a little bit less to begin with. No jobs are really going to start off on a 6-figure salary. You're always going to have to work towards that. So I just don't see sort of why these unrealistic expectations should be put on the government.
Samara's going out with her junior doctor friends tonight to the pub, and the drinks are on her after those comments.
We certainly do need reform. I mean, I found out subsequently to my mum's death that ambulances were backed up outside the Leicester Royal Infirmary. They couldn't offload the patients that they had. The reason that they couldn't was because there were patients who were able to go home in the hospital, but there wasn't the care package for them at
It's the
home.
whole system, isn't it?
The whole system.